everybody. Welcome to the OBL and ASC Marketing Blueprint hosted by Patient Pro Marketing. Today I have Dr. Jeffrey Conaway with me. Today's conversation is something millions of women are told to live with: the pain, the heavy bleeding, the exhaustion, and silence. But what if just dealing with it was never the answer? Today, we're breaking the narrative and talking about a life-changing option more women deserve to know about: uterine fibroid embolization. Thanks, Dr. Conway, for being here with me today.
Thanks, Rachel.
Let everyone know where you're at and where you practice, please.
Sure. Dr. J.R. Conaway. I'm the director here at Clarity Care. We're located in Lenexa in the greater Kansas City metro, and we're treating patients from all around Kansas and Western Missouri.
Yeah, and at Clarity Care, can you give us kind of a synopsis? Like, you do a lot there, right? It's imaging, intervention.
Correct. So we have a pretty full breadth of imaging services that are on our imaging side, and that includes CT, MRI, ultrasound, bone density mammograms, and then also on the treatment center side, we do all kinds of minimally invasive surgical treatments, and there's a pretty huge spectrum of that.
Okay, great. And speaking of minimally invasive, I think that's why we're having this conversation today.
Yeah.
For the listeners out there that don't know, what exactly are uterine fibroids?
Uterine fibroids are benign tumors that are in the uterus. They tend to show up for women primarily after the age of 30 and are stimulated by hormones. So they continue to grow throughout a woman's life until sometimes they will start to shrink after menopause when they're not being stimulated by hormones anymore. And about 80% of all women will have them. Depends on the study. Sometimes some studies will show as many as 85% of all women have fibroids. Not all women are symptomatic from their fibroids, but many do suffer from symptoms of their fibroids.
Well, that sounds like a lot. What are some of the most common symptoms that women will experience once they have fibroids?
Yeah, so there's quite a few symptoms that can be related to fibroids and issues that they can cause. The most significant ones are going to be heavy bleeding, irregular menstruation, heavy menses, blood loss from heavy menses, as well as painful menses, chronic pelvic pain. So there can be lots of pain that are involved with fibroids. They also can cause bulk symptoms because they can grow so big. And there's a huge variety of the bulk symptoms that we talk about just because they enlarge the uterus so much. They often will be related to urinary urgency, urinary frequency. They can cause constipation, bloating. They can cause intestinal irritations. And so there's quite a number of symptoms that can cause sexual dysfunction, as you can imagine, pushing on the vagina and causing painful intercourse. And so there's a huge range of pelvic related symptoms that can arise from uterine fibroids.
Okay, none of that sounds enjoyable whatsoever.
Yeah.
As a woman myself, I'm like, no, thank you. When would you suggest, at what point should women seek medical help or advice? I mean, because some of that is normal, right? Like, when you have
Right.
seen cramping when you have your cycle coming around, but at what point is it not normal where you should seek a physician?
So there's a huge spectrum of how that can occur in each person. And so I guess if people have questions, maybe they should seek out help. Don't just suffer in silence. But some of the things that we talk about and look for are menses that last longer than 7 days, having to use products greater than one an hour during the heavy menses days, irregular menses that are breaking through and occurring often or earlier than would be expected from a normal menstrual cycle. Pain and chronic pain or you know, what seems to be in greater pain than normal. Of course, pain can be related to menstruation, but seeming to be greater intensity than some of the other women that happening before or in between menses can be signs. Ongoing pain that doesn't quit, and then some of these urinary symptoms that I talked about, constipation. Some of these that are just on lasting or going on beyond normal, and especially if you don't have another answer.
Yeah, I think that's well, I've interviewed women, who have had experienced uterine fibroids and gone through different treatments. Traditionally, hysterectomy or a major surgery has been like their only option. And working with us at Patient Pro Marketing and doing that direct to patient marketing specifically for women who have these symptoms, they're trying to avoid a major surgery like that. What other options are out there now that we are going to go into here too?
Yeah, so I'm really excited to see that there's our gynecologists and other providers that are talking about some of these other options for women for uterine fibroids. But traditionally, what will happen is that they'll usually try some kind of hormonal therapy because I mentioned that fibroids are hormonally stimulated, so they'll try to disrupt the hormone stimulation of the fibroids. If your symptoms are getting bad enough, though, that just won't work. Or if you're getting older, and then those might not be such the great options. But usually, for women that are, have the more intense symptoms, then hormones aren't going to be helpful. So then we start getting into uterine sparing treatments. And so those can be myomectomy, which is a kind of uterine sparing surgery. There can be ablations that can be performed. Um, and there can be non invasive things like high intensity ultrasound treatments. Those can be harder to find and locate providers for women to access. Those are some of the other things that women might be able to access that are not hysterectomy.
Your clinic, you offer a minimally invasive procedure, right? Uterine
Yep.
fibroid embolization or
Right.
uterine embolization. Can you explain to everybody what that actually is?
Yeah, that's one of the ones that I didn't mention because I knew you were going to bring it up. So, uterine artery embolization or uterine fibroid embolization, it's the same thing. It is a same day procedure that is minimally invasive. So, there's just a little pin a little pinpoint incision, and it's a same day surgery. They go home the same day. And what we're doing is we're going into the uterine arteries and we're affecting the blood flow to the fibroids. They're growing and they're stimulated abnormally. They have unusual blood flow to them, and they act much differently than the rest of the uterus. And so a doctor very smartly figured out in the 90s that this could be an effective treatment for these. It doesn't hurt the uterus. And so we actually go into the blood flow to the uterus, and we release little beads that get sucked up by the fibroid, which ends up killing them and burning them out in a large degree. And it's highly effective and control their symptoms. That people recover very quickly from the procedure, and we then will follow them to make sure that it's working the way we plan and there's no kind of complications to be treated, but usually those are really minimally and easily addressed. And then we will continue to follow the patient for a short time to make sure that everything's going well. And then hopefully they won't have to see us in the near future if again.
So with UFE, you're not actually removing fibroids or the uterus, correct?
That's yeah, nothing's removed. The body will clean up the dead fibroid material on its own, and it does take time. So that kind of speaks to some of the nuances about it. We will tell patients that the symptoms usually they may improve very quickly, but really we're targeting different time frames or a more delayed effectiveness for this because we're waiting for the fibroids to die and shrink up. And so for bulk symptoms, that can be longer. For menstrual or heavy bleeding symptoms, we expect those to start improving by the third menses after the procedure. And so that's around 12 weeks later, right? And so from then on, their symptoms should be improving, but they may happen even earlier than that. Now, for bulk symptoms like the urinary issues, constipation, some of the bloating or pain, those may be a little bit slower to respond, but there have been randomized control trials that say that they can be just as effectively controlled. It just takes longer to get there, but you don't have to have a hysterectomy to get to them.
Yeah, that's great. What if a patient has more than one fibroid? Let's say they have multiple. Can you do them all at one time, or do they have to come in multiple times?
No, so that's the great thing about this minimally invasive surgical treatment. It treats all the fibroids. And so, is it possible that a fibroid isn't affected by the treatment? It is. That's a very small percentage. And we watch for those kinds of signs that maybe that's happening. But in general, all the fibroids get treated and they're all dead after the treatment. And so, unlike some of the others, which target maybe one or the one that they hope is causing all the problem, no, this will treat them all.
Okay, that's awesome. Now you kind of explained a little bit about the day of. So
Yeah.
where I feel most women lack trust, right, is they don't the expectation. They don't know what's going to actually happen. So if you could explain like the day of the procedure, in a short version that you can. What can a woman expect when she comes into your office that day at Clarity Care, and then how long she'll be there, what kind of anesthesia, and post-op recovery?
Sure. So, of course, we're going to go over all this with you when we do the clinic visit and then before you show up with phone calls. But the day that you arrive, you're going to arrive there in the morning. Hopefully, you've already picked up some medications that we've already prescribed. But if not, then we'll remind you and we'll check to make sure that we have the right pharmacy and they'll already be waiting on you. And so you'll arrive, you get it changed into a gown, you get an IV. We'll have you in the pre-procedure area. We'll go over all of your expectations, kind of review what it's going to be like afterwards and what to expect afterwards, and make sure that you understand all of that ahead of time. We'll get you to sign all the consents and make sure that you're totally comfortable with the procedure. You go back into the procedure room. You get IV medications. They make you sleepy. They take away anxiety and pain. So most patients just fall asleep on the table. We might actually ask you to hold your breath so you're not entirely asleep, but patients don't really remember any of that because we give you quite a few medications to really get through the procedure, but also after procedure as well. So we're giving you medications that are going to help you after the procedure as well as during it to make you comfortable for that. And then also during the procedure, I actually will do, and my other partners as well, we do what we call a nerve block. So all of the pain receptors coming from the uterus all join together in a bundle of nerves, and we actually numb that up. That lasts about 20 hours. So that helps you through that first night. Once you're done with the procedure, you go back into the recovery area. You start waking up from the medications. We'll check your site, that you move your legs around right away and make sure that that all looks good. We'll get you up, let you go to the bathroom, make sure that you're walking around okay, take some drinks of liquid and food. And if that's all looking good, then we'll release you to your loved one or whoever's there with you to drive you home and make sure that you have all the things that you need when you're going to be going home, including all your medications to get through the next few days. And then we'll make sure that all your instructions are well understood, and then we'll call you the next day as well.
Wow, that's sounds so much easier, right, than planning daycare, someone to watch the kids because you've got to stay a night in the hospital. You might have a catheter. What if you can't go to the bathroom afterwards? So I think it's amazing that there are practices and facilities like Clarity Care that has access for those sort of treatments. What would you say the success rate is on a UFE procedure? Like once you go in there and you kind of cut that blood flow off the fibroid, like you were saying, what is the success rate of that? And then what are the chances of it coming back, if any?
Sure. So for the heavy bleeding symptoms, most of the studies will say that we'll control your symptoms at 90% or greater. And so 9 out of 10 women should have effective control of the heavy menses and the heavy bleeding issues. And we expect those to happen and improve by 12 weeks and up to a year later. That should be happening. Can it recur? So all the fibroids, as I kind of touched upon, should be affected. There are some reasons why the blood flow to certain fibroids will be less effective from the treatment. We try to get a sense of that because on most of our patients, we'll get an MRI ahead of time. And so sometimes we can look for factors that might give us an indication that a fibroid might be more resistant to the treatment. And so there are reasons that fibroids can be resistant to the treatment. um, Even if we do the treatment and we think that we've got them all and symptoms are improving, we like to get a follow-up MRI at 12 weeks because what we're really looking for is, did the fibroids react and respond to the treatment as we expected? Sometimes we can find in a small percentage that they did survive and they weren't effectively treated. We'll see if the patient's symptoms are controlled, and if they are, then that fibroid might not be causing them problems, and we might not need to do anything. But if they are still having some residual symptoms, then we know that one somehow survived the treatment, and we can have strategies to go after that if needed. So it's not something that um, is one and done. It's kind of a process that we look to make sure that they're doing okay and we're getting them to their symptom goals that we all want to have, right?
Yeah, that's good. Cause I do get, I've seen comments before where women have said, I've done this, it didn't work. And I feel like what you just said, it's that one and done mentality for some providers, or the follow-up from the patients, life happens, you get busy, you just forget, and then you're back to just quote unquote dealing with it again. So I think that's really awesome that that's your path and also your goal for you as a provider and the patients. They're aligned.
One of the main goals of Clarity Care when I started this is to lower barriers of access for patients to get the care that they deserve and they want to find, because it's really hard in this day and time in our healthcare system.
Yeah, that's true. I think that's great as well. To close this out, Dr. Conway, if there was one thing that you wish that every woman knew about fibroids, what would that be?
You're not alone. Yeah, so there's lots of us out there that are wanting to help, and so you're just not alone.
Yeah, I think that's really deep. I think that's true, and I think it's amazing what you guys are gonna be doing with this live webinar. I'm so happy to help share and bring awareness and advocate for women as well. Um, we will share the links here for everybody. Please, if you have questions, even if you're not local to the area near Clarity Care, I think it's an amazing opportunity to sit with an expert like Dr. Conway and ask those questions because you don't know what you don't know. And that's why we are doing a segment like this, right? Is to bring awareness. And the fact that Dr. Conway literally just dropped the mic and said, "You are not alone." Ladies, you are not alone. Trust me. We are here to try and help and answer questions. So thanks, Dr. Conway, for being with us today. I appreciate you. And I will log into your webinar as well. And I look forward to learning more.
Thanks, Rachel. It was great
Okay.
great to be with you.
Thank you.
Thanks.